Remained a nightmare in most parts of Baringo County for decades. Now, in fact, in some areas such as Mukutani ward in Baringo South, locals have ended up converting health facilities around them into residential homes due to the facilities remaining unoccupied for lacking the required staff and equipment. Residents here are also forced to walk for tens of kilometers to access healthcare. Our reporter Joanne Lating delved into this issue and prepared the following report.
This meandering, dusty and bumpy road leads us to Makutani village in Baringo County. A village that sits over 150 kilometers from Nakuru town and one that has for decades suffered from incidents of insecurity. In March 2017, at least 11 people were killed here, leaving hundreds of locals displaced and property destroyed. When we get to the nearby dispensary, we find many people. You can easily mistake them for patients, but they are not. They are the current occupants of this facility, which they now call home. The children are playing comfortably on top of the incinerator, while their parents continue with their daily domestic chores. The elderly spread mats at what was once the reception area, where they rest from the scorching sun, as other children play on the benches. Not only is this place hosting the homeless, but also the local administrators, including the area chief, his assistant, and police officers.
Mahali niko kwa saa hii. Niko kwa zahanati ya Mkutani. Na hii mahali ninakaa ni nyumba ya staff ya hospitali. Na kwa sasa staff hawako. Na hospitali pia imefungwa.
The mother-child health and family planning room is now home to Joseph Ole Kichep, his wife Rosemary Mudhoni, and their 2 children. Kichep was taken ill 1 month ago, but has resorted to using herbs because there is no other alternative source of health care in the area.
Hospitali hapa nakuja kwa hata karibu miezi 6 10 au 3 hii kidogo ya mobile.
Niko na shida ya miguu. Naye kilomita yenye tunaenda ni 75. Na kama una 500 huwezi ingia gari. Hapa tunategemea magari ya serikali.
Pauline Parquet has converted shelves that were used for drugs and now stores her foodstuffs. She lives in this single room with her 2 children and husband.
Wakati tulipofika hapa, tukaona hospitali hakuna, ndio tukaamua kuishi manyumba ya hospitali. Ndio hatuna mahali pengine yenye tunaweza kuishi.
The residents here, most of who are homeless, were issued with 20 iron sheets to resettle back in Lontiani village, but till today they haven't for fear of their safety. Ironically, despite the dispensary not working as at now, the Kenya Medical Supplies Authority KEMSA strict supplied maternity equipment, oxygen concentrator and a weighing machine. According to the local chief, the facility was fully operational until 2017, when suspected bandits raided the area, vandalizing the equipment and buildings in the process.
Kuna vitu vifaa vingi ambazo zilikuwa hata solar panels zilikuwa kwa hospitali yote, lakini kwa sasa ziko. Hata ukiangalia vile mchwa hata kwa hii nyumba ambayo unaona vile mchwa iliweza kuharibu.
Sirata dispensary, which is 35 kilometers from the village, was also closed. Baringo County Governor Stanley Kiptis said the county government is working to have the people out of the facility to pave way for its intended operations.
Hiyo dispensary, hiyo health center iko pale. Nitauliza kwa unyenyekevu wao ambao walikuwa wanapata nafasi pale, hii tumieni mabati tupate kujenga yetu, alafu tupate huduma kutoka hiyo hospitali.
But for the residents here, their right to proper healthcare services remains in jeopardy and continues to be mutilated and trampled upon. Joanne Lating for KTN News in Makutani area, Baringo County.